So this class is on rectus sheath and its contents. I'm Dr. Gaurav Agnihotri. So the rectus sheath has got an anterior wall and a posterior wall. Now anterior wall of rectus sheath has got some characteristics which you should know. It is complete. It is not deficient anywhere. It is adherent to the rectus abdominis by tendinous intersections, but its formation is variable. In contrast, the posterior wall of rectus sheath is incomplete. It is deficient above the costal margin and below the arcuate line, but its composition is uniform and it is not adherent to the rectus abdominis muscle. So above the costal margin, the anterior wall of rectus sheath is formed by external oblique aponeurosis, while posterior wall of rectus sheath is deficient. The rectus abdominis muscle lies directly on the 7th, 6th and 5th costal cartilages. Between the costal margin and the arcuate line, now all these are the um, transverse sections through the rectus sheath muscle. So transverse section between costal margin and arcuate line is being shown in this diagram. So the anterior wall of rectus sheath between the costal margin and arcuate line is formed by external oblique aponeurosis and the anterior lamina of the internal oblique aponeurosis. So you see the internal oblique aponeurosis is splitting into the anterior lamina and the posterior lamina. Anterior lamina is contributing to the anterior wall of the rectus sheath at this level, while the posterior lamina is contributing to the posterior wall of rectus sheath. The posterior wall of rectus sheath between the costal margin and the arcuate line is formed by the posterior lamina of the internal oblique aponeurosis and the aponeurosis of the transversus abdominis muscle. Now below the arcuate line, if we take a transverse section through the rectus sheath, we find that the anterior wall of rectus sheath is formed by external oblique aponeurosis, which is lying separate, along with the aponeurosis of internal oblique and transversus abdominis, which are united with each other. While the posterior wall of rectus sheath below the arcuate line is deficient, the rectus abdominis rests directly on the fascia transversalis. So the posterior wall is deficient above the costal margin and below the arcuate line. Now this is the sagittal section through the rectus sheath, and now here we can make out the anterior wall of the rectus sheath and we can make out the posterior wall of the rectus sheath. The posterior wall of rectus sheath is deficient above the costal margin and below the arcuate line, but its composition is uniform, while the anterior wall of rectus sheath is adherent to the rectus abdominis muscle by tendinous intersections. Its composition is variable, but it is complete, lying in the whole extent. So this is the rectus abdominis muscle. So what are the contents of rectus sheath that we will focus upon using this diagram? So one is the main content is the rectus abdominis muscle. So it's a large vertical muscle you can make out here, and in the lower part we have the rudimentary muscle called the pyramidalis muscle. That is also a content of the rectus sheath, which is not shown in this diagram. Then we have the superior epigastric artery, which is a branch of the internal thoracic artery. It is passing between the costal and xiphoid regions of the diaphragm. It enters the rectus abdominis muscle. And from below we have the inferior epigastric artery, which is a branch of the external iliac artery. And the two arteries are coming in this fashion. And this inferior epigastric, I told you, it's a branch of external iliac artery. Along with these superior and inferior epigastric arteries, we have the veins, superior epigastric vein and the inferior epigastric veins, and they are tributaries of internal thoracic vein and external iliac veins respectively. Then we have the intercostal nerves, the lower 5 intercostal nerves and the subcostal nerve. They are also a content of the rectus sheath. So this inferior epigastric artery is entering the rectus sheath by passing in front of the arcuate line. We can make out here in this figure. Now this point is representing the level of the arcuate line. So that's the lower part of the posterior wall of the rectus sheath. So this was about the contents of the rectus sheath. We have got 4 contents: the muscles, the arteries, the veins and the nerves. Now we come to the clinical aspects of the rectus sheath. Now in multiparous women or in weak children, the recti, they are separated from each other. So fingers can be put in between the two recti muscles, and that condition is called divarication of the recti. That is the rectus abdominis muscle. There is a gap between the two rectus abdominis muscles of the either side. Now, epigastric hernia is the hernia which is taking place through the linea alba due to weakness. Now, as far as incisions through the rectus sheath is concerned, whether we should go for a midline incision of the anterior abdominal wall or a paramedian incision through the rectus sheath, that now we will discuss. If we make a midline incision through the linea alba, then the advantage of midline incision is that it is bloodless. And now whether supraumbilical incision should be made or infraumbilical incision, then the answer is infraumbilical incision is better, because the recti muscles of the two sides are closer to each other infraumbilically, while supraumbilically there is a gap between the two recti muscles. So there is a chance of ventral hernia if we make a supraumbilical midline incision, and the chances more in case of supraumbilical midline incision than infraumbilical midline incision. As far as a paramedian incision is concerned, here the advantage is that the chance of incisional or ventral hernia is minimal. So what we do is we make a cut through the anterior wall of rectus sheath, reflect the rectus abdominis laterally to preserve its nerve supply, and then we make a cut through the posterior wall of rectus sheath. So advantage is that paramedian incision, when we are making a cut through the rectus sheath and deflecting the rectus abdominis muscle laterally, so the advantage is that later on we place the rectus abdominis muscle back to its original position. Here the chances of incisional or ventral hernia are minimal. So supraumbilical or infraumbilical, better is infraumbilical incision because ventral hernia chances are less. Paramedian or median, better is paramedian incision because incisional or ventral hernia will not take place here. So this was about the incisions in this area. So this is a quiz which I have prepared for you. Just test your knowledge and do look at the explanations provided when you attempt this quiz. When you submit your answers, you will get an explanation of all your wrong answers. And tell me how much you've scored by sending a WhatsApp message. And if you want, I can send this link to your inbox also. You have to text me requesting for the same at my mobile number 98155 42792. So do try to attempt this quiz. You can read the text of today's lecture by visiting www.buzzdesire.com. Once you register and log in, you can access this online book which has been written by me. So do give me your feedback, and thank you till we meet the next time. It's bye from my side.